Vivian, you've described the benefits of fit to you as in part empowering the client. And there's going to be some people watching this video that kind of have a sense of feedback informed treatment, that it's
Yeah.
about like administering a measure of the well-being at the start and the alliance at the end. They might have a sense that there's data involved somehow, but that word empowerment that you
Yeah.
just said that aligns
Yeah.
with your values, can you tell us a little bit more in a day-to-day working with the client? How does doing these measures at the start and end
Yeah.
provide empowerment for the client?
Sure. At the beginning, as you know, the ORS, you're asking them to rate themselves on a subjective scale of 0 to 10 about how they've been, how are they feeling within themselves from either the first session, that's the baseline, but between first and subsequent sessions, how have you been since we last met? It's their voice, right? Second question is, how are you feeling in the close personal relationships? And because my focus is couples therapy, so two-thirds, three-quarters of my practice is couples, how do you rate your experience of how you've been feeling in the relationship? And I ask the partner the same thing. So,
Mm,
thirdly, in your broader social network, the extended family, your friends, your community, your work, how are you feeling? You're coming in here for this. How are the issues that you're presenting with impacting your life broadly? And overall, how would you rate your general sense of well-being? So they give me a number, which gets plotted into the little app, which is very friendly. I show that to them and I go, the number is just the beginning of a conversation. So please tell me, what do you want me and your partner to know about the rating you've given individually between the two of you and socially and overall? And I always, basically just reassure them that you're two different people. It's fine that you're in different places. Like I want to
mm,
hear from both of you. There's always two valid perspectives. So we kind of unpack that at the beginning of the session. So it's them talking about the outcomes of our work together and how it's impacting them. And then I ask them, well, given everything that you've said today about that, what's the thing that concerns you the most? How would you like to focus today's session? What do you want to talk about? And
mm,
how do you think I can help you? So I'm consistently going, what do you want to talk about? What's important to you right now? And what was important last time may not be what's important this time, which is
mm,
always, we have the therapist theory about, oh, well, they talked about this, it's a self-esteem and it's a sexual issue. And the next session, it could be something totally else because life intervenes.
yeah.
So we're not kind of just following the path we think they should take. I'm empowering them to tell me what it is that they're hoping from today's session and each session. And then
Mm,
at the end, the empowerment is all about, well, how much did you feel heard, understood, and respected today? Not by
mm,
me, you're not rating me. I'm really curious in hearing about your honest experience about today's session. And any little thing that hasn't worked, please feel free to tell me about so I can immediately feed that back into our next session so I don't keep doing something that isn't working.
mm,
So yeah, how much did you feel heard, understood, and respected? How much did we talk about what you wanted to talk about today? And I think I've asked them at the beginning, what do you want to focus on? And they say X. So we talk about X and they go, I really wanted to talk about this. And I go, oh, thank you very much. How about I take a note of that and we start there next time if that's still what you choose to talk about. And the third thing, how much did the approach that was taken today fit for you? Did it make sense
mm,
what we did? If not, please tell me what would have needed to have happened, what else could have been added or subtracted from the session, and
mm,
overall, what was your general sense of the session, the final question? And they give me a number and we unpack that a little bit. So if there's anything at all that is alerting, and as it's shown on the My Outcomes app, that it's
mm,
below the 36 cutoff in the SRS, it's on me to kind of ask and go, what else needs to happen? What needs to change? So it's
mm,
constantly empowering them in telling me, I'm not the expert, that this is, I want more of this, I want less of that. That didn't make sense. I like that.
mm.
That's how I work.